Hello, and welcome to our Wellbeing at Work podcast series. My name is Bianca Bowie, and I'm the Ambassador Program Manager here at Workplace Options. In today's episode, I have the pleasure of speaking with Mo, Senior Account Manager at Workplace Options. Mo has been instrumental in supporting organizations run their Wellbeing Ambassador programs. I'm very excited to be speaking with you today, Mo. Thanks for joining.
Hi, Bianca. Thank you for having me on this podcast.
So just to get us started, Mo, can you give us some more details about what the Wellbeing Ambassador Program entails?
Yes, certainly. So the Wellbeing Ambassador Program are initiatives designed to create a network of employees who are trained and empowered to promote mental health and well-being within an organization. So a Wellbeing Ambassador will act as the eyes and the ears of well-being on the ground. They're often volunteers who are passionate about wellness and mental health related topics, and they become advocates for a company's wellbeing strategy. Ambassadors encourage participation in wellness activities and can also signpost people to wellbeing services like the EAP. So at times, these individuals can provide feedback to their leadership in regards to what employees might be feeling, any particular suggestions they may want to make. They can obviously share that with leadership. So they become certainly a key asset to the organization. The programs are typically part of a broader company wellness strategy and focus on fostering a supportive, inclusive environment where health for both mental and physical is prioritized. The idea is to create a ripple effect where the ambassadors inspire their colleagues to engage in healthy behaviors, seek support when they need it, and contribute to a positive workplace culture. Clients who've run the Wellbeing Ambassador Program have the ability to be creative in terms of how they market and promote the roles as well. So we like to call the ambassadors or wellbeing ambassadors, individuals who are trained as ambassadors. However, some clients who I've worked with and other clients that we've actually supported and trained have called these individuals allies, champions, coach. So it's whatever kind of fits the culture of the organization. So I've been with Workplace Options since 2018 as a senior account manager, and part of my role is to have conversations with clients around a variety of different topics pertaining the EAP. So these topics, the trainings that we offer, the EAP that we offer, it's there to support employees and also managers. So since COVID, we've certainly seen a shift in mental health topics. We're seeing more and more clients coming to us and informing us of employees or managers who are struggling with mental health issues, amongst other personal professional challenges. So in these conversations with clients who already have EAPs or trainings, they are wanting more creative ways to increase engagement, visibility, and adding and recruiting people within the workplace the employees would feel comfortable to speak to. One of the components of the Wellbeing Ambassador training is our psychosocial risk assessment. There are a number of questions that we ask employees in this particular assessment, but one of the most important questions is that we ask employees if and when they were to experience any mental health related issues, who were they more likely to speak to? So the top two results were family and friends, which is expected. But the results also showed us that the employees would next speak to colleagues, a fellow colleague, as opposed to going to a manager or HR. This information showcases to us the importance of having an ambassador-like role within the organization. So having someone who's trained to have these difficult conversations, signposting people, and being approachable becomes more important. So it's important to create a safe and supportive environment so that when employees stress or anxious, or when they need help, they are speaking to a trained colleague who's accredited, assigned for that exact reason. So if we can train up these colleagues to be able to have these difficult conversations to help people when they are stressed or anxious, when they need help, by creating the culture where these ambassadors become key advocates and resource for individuals within the organization. It's important to note that these individuals are not counselors, but are trained to understand their roles. So they know when they need to refer individuals to HR if there's anything that's policy related, but they also know if there are individuals who might be struggling with some mental health related issues, that they can signpost them. They can talk to them about how an EAP can be a very useful resource for them, encouraging them to have these conversations. So in a nutshell, the Wellbeing Ambassador Program is something that we are now seeing more and more of. Clients are requesting trainings such as the Ambassador Program a lot more. So it's a trend that we're seeing, and I'm glad that we are having these conversations with clients, and clients are investing their money and time in these programs.
Thank you for that, Mo. Can you talk to us about WPO's blended version of the Wellbeing Ambassador training? What does it consist of, and how does that version differ from the standard training version?
Yeah, so in terms of the training itself, and why organizations might be opting for the blended version of late. So the live session, the training takes up to 12 hours in total. So while this approach has its benefits, a blended version will break up that training into smaller parts. So the blended version that we're referring to converts 2 hours of live training into 8 small pre-learning based e-learning modules, with the remaining 6 hours conducted as a live session, which most clients will deliver over 2 days. So the e-learning component will have a blend of learnings, gamification, videos, and each module, once completed, requires the individual to actually complete a quiz, ensuring that people are attentive. A final quiz of the overall learning is added to the e-learning platform post the live session. So once you've completed the 8 e-learning modules, once you've completed the live session, of which is 6 hours of sessions, the individuals go back to the e-learning platform and complete a final quiz. Upon that completion, a certification is generated. So the blended version certainly has a lot of benefits. It's flexible. So in a busy workplace, it's hard to give 12 hours or 12 consecutive hours of your workday to a training topic. So with the e-learning modules, employees can engage with the material at their own pace during the times that are convenient to them. And then self-paced learning allows participants to absorb the information a lot easier as well. Second, so reinforcement of learnings. So with e-learning modules, participants can revisit the content whenever they need to refresh their memory. Individuals are eased into the program, so the pre-learning modules will give the ambassadors some indication of the type of training that will be delivering once they enter the live session. So they've got a bit of an understanding before they enter into the live session. And finally, the live session. So the live session offers opportunities to these ambassadors to be in a group setting, to interact with others, be involved in discussions and activities that are critical for a wellbeing ambassador training. However, with the foundational knowledge covered in the e-learning modules, the live sessions can focus on more practical applications, role-playing scenarios, and deeper discussions.
Thank you for that, Mo. Can you share any examples of organizations that may have provided this type of blended version to their employees within their company?
So yes, I can. I was heavily involved in the discussions and helped project manage of what became the blended version of the ambassador training. So this started back in 2022, a conversation with a big global tech consultancy firm that I was managing. They wanted to introduce a mental health allyship network within the employee population, and they were interested to learn the work that we did in this field. So we had a number of meetings with this client in which we promoted and discussed some of the details, the finer details of the ambassador training, and they really liked the way that the conversations were going. However, they felt that 12 hours of live sessions might be difficult for them to kind of put people aside from their day-to-day work and dedicate their time to a 12-hour live session. So for that reason, we were looking at exploring ways of not losing some of the quality, some of the core values of the ambassador training. So we looked at an e-learning platform as a way of transitioning some of the foundational based modules across to e-learning and making it more appetizing for the client and making it more appealing and more engaging. So over those months that we collaborated with the client, we showed them some of the modules as they were being built. We tested some of these with the client to ensure that they were running smoothly, and they absolutely loved everything about it. So the client was, highly engaged in this particular initiative, and they decided to roll this out to all of their HR. So we rolled this out from 2023 up until mid-2024. We trained all of their HR managers. But before we actually trained them, they asked us to actually interview each individual HR manager just to ensure that they were suitable for the ambassador role. So based on that, we were able to interview everyone, train everyone. All of the HR managers were trained. And then we offered a monthly and quarterly peer-to-peer sessions, which was led by a trained clinician. In this, the ambassadors were able to meet with other ambassadors, share best practices, and discuss any particular topics pertaining their roles, or some situations that they might be coming across. But it was shared in a confidential way without sharing any particular names. So since then, the clients now fully trained all of their HR managers, and they are now marketing this to all of their employees who may be interested in wellness-related topics, may be interested to become a volunteer and ambassador. So that particular project is continuing on, and we've got a lot of employees still to train. So there's a big amount of interest within this organization. So the client has a number of in mind in terms of how many ambassadors they require in each location, in each country. So we'll aim to train all of these in the coming months and years.
Thank you, Mo. That sounds awesome. And how have you seen organizations effectively communicate this role of well-being ambassadors to their employees?
Yes, it's a good question, Bianca. So in terms of communication, I would say it's certainly a key thing before you implement such a program. Implementing any wellness-related initiative, it's fundamental that you have a good communication plan and strategy. So organizations have to ensure that they define the role of an ambassador, both to the ambassadors, but also to the employees. So this includes explaining that the wellbeing ambassadors are not HR representatives or counselors, but they're trained individuals or trained employees who are there to offer support, encourage engagement, and serve as a resource for wellbeing initiatives like an EAP. Effective communication strategies often involve a formal launch of the ambassador program, including emails, town hall meetings, where the purpose of the role of the ambassadors are shared with the employees. So they have a good understanding of what's about to be launched and who those individuals are. So I have some clients of mine that have used global and regional newsletters, showcasing those individuals with their pictures, their names, email addresses. Some clients, especially in blue-collar sites like warehouses and production sites, have used office or staff bulletin boards communicating these roles. So once again, adding their pictures, adding their names and roles so that people know who to go to if they're going through a particular challenge. Some clients of mine who have promoted this particular initiative and the fact that they've launched the Wellbeing Ambassador Program on their LinkedIn. It's also under those ambassadors, under their email footers, and some clients have used different coloured lanyards. So it's clear and visible. So, I think from all of this, we can see visibility is fundamental. So they've looked at all areas of that to ensure that employees are fully clear and aware of those individuals that they need to go to, and ambassadors are aware of their roles. So these initiatives show employees that their employer cares about their well-being, that they've invested a lot of money into this, and employees see it everywhere. So a client of mine successfully implemented this program globally, identified how many ambassadors they might require in each country, in each location and site. So therefore, they were ensuring that they have multiple ambassadors in each of their sites. In account management, I see it more with my EAP-based clients, where we typically speak with HR, health and safety managers, compensation benefit leads, and other departments. But we're now having conversations with these ambassadors in different countries, in different business divisions or units. So their feedback becomes vital as they are having conversations with the employees and are in a good position to share insight around what might be needed, whether it's training requirement on a particular topic, if it's raising awareness of the EAP, if it's promoting an international event like the World Mental Health Day that we have every year. So they can share these ideas with us as account managers, and we can certainly support them further from that point onwards.
And how can the impact of having well-being ambassadors be measured within the workplace?
So measuring the effectiveness of Wellbeing Ambassador programs is crucial. Ensuring that they're having the desired impact is something that clients would always want. So one way to do this is through employee engagement surveys. Organizations can include specific questions about how well employees feel supported by the Wellbeing Initiative, whether they know who their Wellbeing Ambassadors are, and how to engage with them. Other important metrics is the participation rates in wellbeing activities, how the utilization, things like the EAP. We have metrics of late that show 77% of organizations that have completed an ambassador program in 2024 will see an increase in utilization and engagement. 15% of organizations saw 100% or greater utilization of the EAP. 25% have seen a 50% or greater increase in EAP usage. So clients can also measure the increase in visibility of wellbeing programs and how often ambassadors are approached for guidance or support. So clients are investing in this and ongoing support, ongoing marketing campaigns are helping clients build a positive change in culture, mindset, and helping reduce the stigma around mental health, which is still prevalent in many parts of the world. So empowering employees to take this role on is very powerful. So to wrap things up, Wellbeing Ambassador programs and the trainings, whether they're delivered through standard live sessions or a blended model, they're a vital tool for promoting employee wellness and wellbeing. By empowering employees to take this role on, organizations foster a peer-led support system that can make a real difference in the overall wellness of an organization.
Thank you, Mo. Thanks for being with us today. I really enjoyed our conversation. To our listeners, to continue to learn more about our Wellbeing Ambassador Program, please visit consulting.workplaceoptions.com, or you can email us directly at WPO Global Consulting at workplaceoptions.com. Until next time, take care.